Hello, SJ here, quite literally working from home in the kitchen. But I wanted to jump on quickly. I've just had a few things to update you on. I don't want to hang fire on it. So here we are. So TYPP, the Yoga Pilates place, it's been a mad 18 months, really. So things massively changed. A lot of classes that we used to do, we can't do anymore. And we've been back, everything's changed. We think for the better and we want to keep that momentum going, but we've had to look at, okay, how do we get open more days? How do we still keep you all safe? How do we keep the classes and the services that we're running world class, excellent, best teachers, all of that great stuff that we're known for? So we've been on the hunt. We've been looking for some new professionals to, one, help me in the clinic side of things. Clinic has been an absolute godsend over the last 18 months. It really has been the thing that's made the difference in helping us still be here. And I knew that I needed to bring in some more excellent clinicians. So I'm pleased to say we have Scott, who's going to be joining us towards kind of mid-end of September. So that means that we're going to have much more availability on the clinical side. We're going to be open more days. Scott is a podiatrist like myself and also a sports therapist like myself. So all your MSK problems, like I do, he's basically going to be the same as me. We're also bringing on a massage therapist. So for those of you who just want to come in and just get a blissful massage or a deep tissue massage or a sports massage, that will be available as well. So dead exciting. And we've got a few new members of the team to bring into that. Another big thing that we've been trying to do is work out, how do we bring back yoga in some form? Now, for us, we are much more rehab, the rehab hub, more clinical. And many of our clients, that's what we're known for. So we want to stick with that kind of way. We want to use yoga as a way of rehabilitation and getting your body moving, improving your posture. Less of the kind of meditation and side of things. There'll be none of that. More that meaningful movement of your body. So we're pleased to say we have yoga starting back. It's going to be a Monday evening at 7:00, and it's going to be with Chris, our new yoga teacher. So we can't wait to get you all started with that. These classes will be a maximum of 10, no more than 10 in these sessions, or between 8 and 10. And it'll just be a class credit, just whatever's on your account, you just use a class credit. It's the same way. There'll be no different passes for yoga or for Pilates. It'll just be the same. Other things, we've been listening, we've been asking those of you that have been coming since we've been allowed to open back up, what do you want to see more of? And we're taking action on that. So some of the things that you want to see more classes, you want to be open more. So we're doing that. We've opened up on the Friday. So as things get busier and as we bring in more teachers and as we feel comfortable with the flow and that we're keeping up the high standards of cleanliness, we can do that. We're going to stick with classes usually starting either on the hour or on the half hour, running for 45 minutes, and then it gives that 15-minute changeover to clean down, crossover of any people in the building, so that one class is leaving before the other new clients are coming in. So there's no congestion at the reception area. So we're going to stick with that. I think it's only sensible to do that. So we're staying with that. But what we're going to do is we're going to be putting more classes on. You've probably already seen that. The Friday's been on the last 2 weeks. And we've also got more classes on the Monday. There's more going on in the Saturday as well. And I'll talk to you about that in a minute because we've got some exciting new classes coming on. So one of the big things we wanted to do was get a bit of mat Pilates in as well. And after a meeting with Linda today, we had been toying with an idea of doing a reformer mat fusion, because we've got so many props and so many fabulous tools in the studio. We thought, why don't we put on a class that utilizes the mat work and the reformer and other props in the same class? So the reformer mat fusion will be a class that essentially when you're coming in, you'll be utilizing the reformer and the mat. Exciting. So you're doing mat work and the reformer. So you'll be using both methods. That's going to be going on towards the end of September. The 20th of September, we're going to launch that. That week commencing the 20th of September, that's when the new timetable launches. And it's going to be on a Saturday at 12:30 with Linda. So that will be the Reformer Mat Fusion. Now, the other thing that many of you had been, just checking, if there's any comments, just let me know, just ask away, is many of you had asked for advanced reformer sessions, and we don't take that lightly. We're listening to it because we get that many of you are coming to classes, and we've got to be very, we're taking 8 to 10 people in a class. That's a lot of bodies, and not everybody's at that advanced level, and we're not comfortable. We don't think it's safe to have an advanced class with that many people in it. So that was a hard no in that sort of environment. However, we know that one-to-one sessions are an excellent place to be if you want to advance your moves and really get deeper into your Pilates method. That's always where we would recommend where you go. Book one-to-one sessions, because you will advance more than any other way. However, we wanted this interim place where we had a solution there for you. So what we are proposing is that we're going to do a few pop-ups to test this out. And we're going to almost have like a challenge reformer class. It's much more advanced. It will be way more advanced. And we're going to pop these up at the moment, probably every 2 weeks, every month, really to test this out, to see if it's a concept that works. One, for us to test it out on you guys and how you cope and the how it's flowing. You can feed back into us. And two, to give it a bit of time for people to see whether or not they like it. So the idea behind this is we do this in the semi-private room with a maximum of 4 of you. So it'll be a semi-private session, and it will just be like any other semi-private session. You can use your class credits, so just 2 class credits for the semi-privates, and there would be a maximum of 4 of you in that more advanced reformer session. So we would love your feedback on that. Is that something that you would be interested in doing, more advanced moves? We'd obviously only encourage clients who are at that level to attend that. We wouldn't put a certain number of classes on that, because you could have done 100 classes and still not be at that level. So it's more about us actually saying to you that that would be appropriate. So what we intend to do with myself and Linda, because we know all of you so well, is reach out to you on an individual basis and invite you to book that. And as we see how you're doing in your normal reformer classes, we would just say to you individually that that would be appropriate for you to book. So that's how we're proposing to work these almost like pop-up challenge reformer sessions. Advanced, we're still working on the name. We're thinking challenge reformer sessions. We think advanced is maybe a word that's overused, isn't it? So, but it will be much more advanced moves, a lot like high energy. You really will need to have good experience on the reformer. We wouldn't be able to take you if you were not able to cope. And it won't be a case of, even if you'd been doing reformer for 10 years, but you're not able to sustain that in a safe way, we wouldn't permit you access into that session, because it just wouldn't be safe. So it will be an individual invitation to book them, if that makes sense, so that we're only saying to people that are going to be able to safely cope with the moves that we will be taking you into in that. So I hope that makes sense. We think that that's the best way to manage that at the minute. So it'll be pop-ups at the moment, maximum of 4. And if they prove successful and it's a format that you all like, then we'll roll it out on a regular basis. The initial one we're looking at the moment, I spoke to Linda today, is we're looking at the first one being in the next few weeks, a Friday morning at 11:30. So let us know what you think. There's many of you that come to daytime classes that will really enjoy that. Now, the other thing that I wanted to put out, and I'm going to put this out in a newsletter as well, was the proposal of VIP booking. So within TYPP, when you book your classes, you've got I think it's a 10-day window, it's a 14-day window, it's a 10-day window. It's either 10 days or 14-day window you've got to book your classes, and that's for everybody. But what we want to do is those of you who are on memberships that are at the level of £96 up, so that I think that's like platinum level up. So if you're paying £96 per month up, what we want to do is we're looking at almost like a VIP booking service. So where you get priority booking because you're committing to a membership, you're paying monthly, and you're on quite a high level of membership, so more of a VIP membership. What we want to do is look at offering where we book your classes for you. Now, you would still be responsible for cancelling your classes. We will not take any responsibility for cancelling you out of classes. But what it means is that you can quite literally send us on a monthly basis the list of classes that you want booked into, and we will basically book you into them. Now, given that people with class passes will be able to book as well, what we would suggest you do is that you're giving us the kind of month ahead, so that you're basically getting priority booking, because what we want to have is almost this VIP type membership for those of you that are on a high level membership that really do get priority booking, and we basically book you into those classes for you. So what do you think of that? Is that something that those of you that are at that level would like? It would mean that you don't need to go on and book your classes. However, you still need to cancel. The management of cancelling classes wouldn't be sustainable at our end. So you'd need to be responsible for cancelling your classes, and you would get into trouble from us if you don't cancel. But what do you think of that? So we're just putting this out there. It was something that we know that for many of you, it can be a bit frustrating. And we really do want to differentiate between those of you who are committing into a membership with us and a substantial investment of a membership, and give you a wee bit more VIP service. So we really just want your feedback on that and what you think of that. So that would be something that we're looking to roll out. There's not lots of you that would cover, so it is manageable at our end. So I think that is it. So new staff coming in, Scott, but you'll see Scott, podiatrist and sports therapist, is going to be coming in over the next few weeks. We've got Laura coming in next on Wednesday next week, where I start back after my hip surgery. I'm back on Wednesday, so tower classes are back on. Get booking. I think Wednesday night is full, but Saturday I believe has got one space in it. And Laura will be in shadowing me on Wednesday. So we're looking at bringing Laura in as a massage therapist. She's also a yoga teacher. Chris is going to be joining us on a Monday night, who is a yoga teacher. It's going to be a vinyasa flow at 7:00 on a Wednesday evening. So fabulous. You could come and do your reformer with Sarah at 6:00 and then stay on and do a nice vinyasa flow with Chris, should you wish. That just brings me on to Sarah's class at 6. That goes back on as well on the 20th of September. Poof! So much information there. So lots of new classes, lots of new faces. Well, 3 new faces coming in. New services coming in as well. Oh my goodness, I've not even got into that. But just briefly, while I'm overloading your brain, we have been working really hard to bring in more innovative, more cutting edge treatments within the clinic, right? So we've obviously got the rehab hub posture podiatry in TYPP, many of you will know. And in there, we offer sports therapy, we offer podiatry, MSK. So essentially, if you're in pain and it's your human movement biomechanics injury that's causing it, we're your people. So we have Shockwave. We've had that for about 6 months now. Many of you might have seen that. I'm not going to get into the details of Shockwave, but we do offer full Shockwave service. We also have the low-level laser therapy, so for inflammation, arthritic, rheumatology, any kind of these kind of problems that you have. Amazing for pain management. Honestly, amazing for pain management. I used it after my surgery. I took the laser home because I had a full hip replacement. I had a full just a month ago, and mean, honestly, the bruising and the mess was a riot. I'm doing my own case study and documenting what I did for my rehab and my recovery. And I used the laser 5 days post-op, took the dressing off, and I mean, it was a riot. It really was a riot. There was just the swelling, the bruising. I looked like I'd been kicked by a horse. Black, blue, yellow, purple, every colour you can imagine. The swelling, what, it was horrible. Use the laser on it on the edema setting to reduce the inflammation. Then use what's called the biostimulation, basically tissue remodeling. We use that a lot for diabetic wounds that are not healing. We use it after nail surgery. So I use that on my wound. And I will do a share, hopefully they're not squeamish. I'll show you the before and after. And I took, re-put the dressing back on, and then it was day 5, day 8. The difference in that was insane. Swelling completely gone, bruising all but gone. It was still a bit yellow, but the red and the purple and that way, that raging, that was all gone. And by day 11, it just was like a little line. It was insane. It was really amazing. Even when I was going in to get, because the stitches weren't even out at that point, the nurse had said, she's like, my goodness, you've healed so well. And anyway, so I used the therapeutic laser on that. So we've invested in that. We have that in the clinic now. Great for tissue healing, inflammation, arthritis, joint pain, that kind of stuff. Fantastic for. But we wanted to also look at next line. So when things like shockwave and laser therapy, these would be kind of second line, what we would call, so you have your first line, which is usually your rehabilitation, quite conservative treatment, right? Then you would have second line where we actually start to use something like shockwave or laser therapy or dry needling, and we do that into you. And then third line would be things where we're maybe injecting things into you, like corticosteroids or hyaluronic acid, or doing PRP. Talk to you about that in a minute. And then fourth line would be referring you to surgery. So we wanted to kind of really up the ante in that third line. So for many of you, we can already do steroid injections, we can already do local anesthetic injections, but we wanted to bring in some other solutions to that. So a steroid injection is all very well, but it doesn't come without its risks. And great for, localized inflammation into joints and the reduction of pain, right? But it does, so for example, if you were coming in with plantar fasciitis and we put a corticosteroid injection into that, it certainly wouldn't be first line, because there's risks associated with us doing that. When we put steroid into that tissue, we are degenerating that tissue. We are going to have a negative effect in the long run towards that tissue, and it does place it at a higher risk of rupturing. For example, Achilles tendon, tendinitis, that would be a very risky area to put a corticosteroid injection into. You would never actually put it into the tendon, but you can bathe the tendon in it. But again, with that, it does leave that really, really, really vulnerable to rupture. So I wanted to look at other more natural solutions that are out there in the market that don't involve just going straight to that corticosteroid injection. And this is where the hyaluronic acid, so for going into joints, so for knee arthritis, any kind of foot arthritis, ankle arthritis, as a lower limb specialist, that's where we would go. We wouldn't go anywhere up with that, so from the knee down. So we can now offer hyaluronic acid. So for example, if you have arthritis, maybe in your big toe, and you're struggling, it's really giving you pain, we can hyaluronic acid into the joint and give you more, basically it's giving you that kind of synovial joint fluid around the joint where you've lost that. The same with your knee. If you've got that grinding bone on bone, that arthritic type pain, that horrible pain that you get, we can do hyaluronic acid into that. And essentially it just acts like a buffer. It gives you that buffer that you've lost. So you're reducing that friction. Now, the other thing that we have brought in as well, which is I think even more natural than the hyaluronic acid, is the PRP. So the plasma, injecting the plasma into your body. So essentially what we do with that is totally organic to you. It's not a prescription medicine, it's not a steroid, it's not hyaluronic acid, it's your own tissues that we inject back into where you need it. So with this, what we would do is take a small amount of your blood, like 40 mils, not a big deal. So we literally just take a little bit of blood. It is easy peasy. And then we centrifuge it, we spin it, and we get the plasma. So it basically separates the plasma and it separates the red blood cells. We then, from there, take the plasma, we spin it again in the centrifuge, and then we get the platelets from there. We then usually at that point will get about 5 mils of platelets out of 40 mils of your blood. And we can inject that back into where you need it. So into a joint. So for example, if you need it in a knee, if you need it in an ankle, if you need it in a foot, we can then do that. And what that is doing is regenerating that tissue right at the source with your own organic tissues. It is so low risk. It is pretty much painless. A wee bit like getting a wee needle in you, nothing major. And usually you only need that a couple of times a year, and it could be the difference between really giving you that pain, reduced pain. Again, that would be from really the kind of pelvis area down. We wouldn't be doing hips, that's not for us to do, but we could be doing into the grazed trochanter area, so the side of your hip, knee, absolutely fine to do that, and anywhere obviously ankle and foot. So that's the PRP. So much. The other thing that we have brought into the clinic, many of the patients that are coming in, what's happening is that we're having to, like, we work multidisciplinary, we have to work with orthopedic surgeons, we have to work with other physios, we have to communicate with patients' GPs. And for a lot of our patients, what we were finding is we were referring them out to the GP to get blood tests done. And it was almost like a bottleneck, because GPs are absolutely hammered just now. They really are that kind of gatekeeper to everything. And I really do feel for a lot of GPs, they are getting hammered. And we're sending, right, you need a full blood count, or we need to check if your inflammatory markers, or maybe we're wanting to rule some things out. And it was just getting a bottleneck. So a lot of our management was getting delayed because we didn't have the results of blood tests that we needed for patients to see where they needed to go and what their management needed to be. So for example, we've had a few patients in recently where we've had to refer them on to rheumatology because they were suspected that there's something more inflammatory going on, whether it's fibromyalgia. There was one girl that recently with ankylosing spondylitis. So we needed those blood results to really know where we were at, to see, basically to continue and get her the right help that she needed. So what we now have available in clinic is, we're healthcare professionals, so we've now linked up with a local lab and we can actually do your blood testing in-house. So obviously what I did while I'd been off is made sure that I did my phlebotomy training, because as a podiatrist, we inject things in, but we don't normally take blood out. Usually another clinician would do that, where we'd send you to a nurse, they would send you to a technician. But what I felt was that we needed to have that continuity. If a patient needed a blood test and we needed that to know where we're at on that management plan, and we don't want this taking months, like 6 weeks down the line before we've got an answer. So that's what we've done. So we've linked up with a local lab. We're fully phlebotomy trained. That's all done there now, and we can literally have your results, usually 24 hours to 48 hours. We can have your results back. So great for things like checking HbA1c for clients maybe with diabetes, and we're managing that diabetes for them. Great for checking inflammatory markers. So if we suspect that there's something more sinister going on and we want to check that, if there's anything there. And then what that means is we're getting those results back very quickly. We know exactly what's going on, and then we can then refer you where you need to be, whether you do that privately, whether we refer you to if you're with Bupa or whoever, we can refer you where you need to be. That is then communicated also via letter to your GP, so they have that information, and they can also, if you want to tap through the GP and be referred via the NHS, we can link into that as well. So it just speeds the process up and allows us a much more joined up way of managing your plan. So loads and loads and loads going on. So loads of new treatments, lots of new services. So you'll see these going on over the coming weeks, days. I'm going to get a newsletter out to you, probably not today because there's just so much to put in it. Probably need to send a few just so I don't overwhelm you. But basically what I would like from you, those of you that are coming to the studio, is a little bit of feedback on what you think of the kind of advanced format that we're proposing. What do you think of the reformer mat fusion? Is that something that you would like? Really just giving us more options, getting the mat work out. And, you know, we would like to expand the services. So we have a membership that isn't advertised. You'll not find it on the website. It's called Self-Care. And we want to add some services to that. So a big part of that, obviously, myself, I'm a podiatrist and a sports therapist. I can do massage, but it really is we really need somebody else to be in doing that. So bringing somebody else in to do more massage focus, whether it be Swedish, sports, relaxation massage, we really, really needed that kind of somebody focused on that and getting all three of our clinic rooms up and running at the same time. So it's going to be a lot more availability for you, which hopefully is great. So it just means that you're not struggling to get an appointment, because I know that for myself, the diary fills up stupidly quick. So by bringing in Scott, who pretty much does most of the same services that I do, so that picks up a lot of that as well. So you have many more options, and our new massage therapist as well. So if you want a nice chilled out massage, or if you want a wee bit more deep pressure massage, then she's going to be there for you as well as that option. So I'll sign out there because that was a whole lot, wasn't it? If you have any questions, give us a holler. But hopefully all of that excites you. For those of you that are, thinking about the kind of advanced stuff, so there's a few of you we've kind of written down some names that we know already that had been asking for that. So let us know what you think, because it's only going to work if that's something that you want. We listen to your feedback. There's more late classes going on as well. I can't remember the name of the lady that had emailed in. Is it Jill, asking for more late classes? So there are going to be more late classes, 7 o'clock classes. There's going to be a Wednesday evening that I've totally forgot to tell you that. So there's going to be a Wednesday evening reformer class going on. That'll be the 20th of September as well. That the week commencing the 20th of September. Tons. My head is burst. Right. I'm going to get back. I'm actually mid cooking the kids' lunch, dinner. It's kind of like a mix of both. I'm attempted to make a pesto. Looks good actually. So we'll see if they'll eat it. It's a nice pesto pasta with some broccoli through it. Yum yum. All right, I'll see you all. I'm back next week, next Wednesday. I'm back. I should say the tower classes are on Wednesday night. Get booking in. I cannot wait to get back moving. I'm not entirely sure how I'll be. I'll not be able to move the same way as I was. It's only been a month since my surgery, but I just can't wait to get going with it. All right, speak to you all soon and have a fantastic, what day is it? Friday. Fantastic weekend. Woohoo, it's Friday.